Welcome back to Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We have consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor, and I'm your host, Alicia Taylor. Welcome, Doc.
Thanks, Alicia. Hi, everyone.
Hello, guys. This week we are going to talk about the thing that keeps our head above water, our neck.
Our neck.
Listeners, please make sure to check out our social media handles. That's Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music for Instagram. And on Facebook, we are Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com. So, Doc, this part of us that connects our heads to the rest of our bodies.
Right.
Let's talk about that.
The neck. Mm-hmm. So the neck, another name for the neck is cervical spine.
Cervical spine.
Right. So
that's good. I can remember that.
Yes, because, cervix, just like in the women, the cervix is from the word cervical, and it's the entry to the uterus. Mm-hmm. So cervical means neck. Okay. And so our neck is made up of 7 vertebral bodies, 8 vertebral nerves, right? And it starts at the base of your skull, at the occipital bone, at the base of your skull, and it goes all the way down to the thoracic spine. And so a lot of times we all have neck pain. You ever have neck pain yet?
Oh, yeah, man.
When?
Me have neck pain.
Yes?
A lot of times when I wake up in the mornings.
And what else? When you on the phone, when you're doing,
man, when I'm doing this.
Messaging, right.
With my phone at my ears and my shoulder.
Yes.
Right.
A lot of people have neck pain, and especially since the pandemic, a lot of people are now working from home, where their area of working is not the most ideal. A lot of people in their cars, on their phones, etc. And so your neck can be very painful. Wow. The interesting thing about the neck is that neck pain that arises from the neck can give you a headache.
Neck pain
can give you pain in your arm, can give you pain down in your shoulder blade, your scapula, and it can give you pain down in your back.
Why is that? Is it because of the spine?
It is because of the spine. The upper spine, where the nerves come out, they actually go forward. Some of them actually go forward, and they innervate or they send nerve sensation to the scalp around the hairline. Right? And sometimes when those nerves are firing, you get referred pain. It's interesting. I have knots in my shoulder, and there's a particular knot, which is a trigger point. Yeah. When I press it, my temporalis muscle right here hurts.
Temporalis, yes.
Yes. So my son has it too. So when I press it, he's like, "Mommy, you're giving me a headache." So they're trigger points, right? Oh. So neck pain can cause headache when it's referred to the head. It can cause, of course, neck pain. It can cause pain in your teeth. It can refer pain into the mouth. It can cause pain down the arm, nerve pain, radicular pain, and it can cause pain down the back. And so, how do we organize it?
Organize neck
pain. Yeah, okay. We have to organize it in some way.
Let's hear it.
All right, so let's talk about the first type of neck pain, when it's muscular, from a bad posture. You ever see some people when they're sitting at the desk, they're rounded shoulders.
Yeah, that's probably me.
The pectoralis muscles. Yeah. The pectoralis muscles in the front, they're tight. And then in the back where you have the periscapular, peri mean around, scapular muscle, those are weak. And so when you have a kyphotic posture, poor posture, you tend to put the neck under a lot of pressure. So you get knots in the muscles. And remember, myofascial knots are really trigger points where the muscle fibers are supposed to move and glide normally, but this time they're in the knot. You have a knot? You have any knots in your neck?
No, woolly. Oh, in my neck, actually here, like in my show.
Right.
Traps.
Trapezius muscle and the supraspinatus muscle.
Those muscles.
Right. And the sternocleidomastoid, which is the one to turn from left to right.
I know that one. I actually know that one.
Yes. Actually, that affects singing if it's too tight.
I know that one. That's why I said I know that one.
Yeah, man. And so, you good girl. And so when you have muscle spasm in the neck, or you ever get a crick neck yet?
Yes, man.
In America, they call it crook in the neck.
Time and time again.
You use a left person to turn your neck and release it?
No, but just kind of just make it stay.
Yes.
And take my time and kind of work it out day by day.
You know what a crick neck is?
No. I mean, I know what it is I don't know what it is. Tell me. What is a crick neck?
Neck is where the neck is in a lot of spasm. Right? Sometimes some like wry neck, they call it sometimes, or torticollis. Where the neck is kind of fixed in a particular position. And that's just because the muscles are in spasm. And so it might be because the muscle itself is knotted up, is locked up, or there's something that's pinching like a nerve, and the nerve then causes the muscles to go into spasm.
Okay. All right, Doc. So Jamaicans, we call it crick neck.
Yes.
Right? And we get that when after we sleep and we wake up, neck crick.
And you go bed good, eh?
We go bed nice and all right,
Yes.
wake up and my neck can't turn.
Yes.
So what causes that when I'm asleep?
Yeah. And so a lot of times we go to bed and we don't realize sleeping position is very important. The ideal sleeping position, if you're on your side, if you're a side sleeper, you should have a pillow where the height of the pillow allows your neck to be straight. So if you're drawing a line from your forehead, down through your nose, down through your mouth, down between the breasts, it should be straight. So if you have a pillow, it shouldn't be too low so your head drop down, or it shouldn't be too high so your head is cocking up. Right. And so if you're in the position where the spine is not in a neutral position, you're going to have muscles. One muscle is going to be under pressure, firing to try and keep you straight, or you may even be pinching a nerve. Because the nerves in the cervical spine exit through what we call the neuroforamen. And so when you go, in a lateral flex position, you might be pinching the nerve, and then the nerve just gets ticked off, and it just causes the muscles to go into spasm.
So how am I going to know?
Well, it depends, because sometimes we actually fall asleep on a bigger pillow.
Yeah.
And you're not supposed to fall asleep. You're not supposed to sleep on a big pillow.
Not a big pillow, not a small,
and not a flat pillow.
And
And similarly too, if you're lying on your back, if you sleep on your back, you don't want the pillow too high, so you're like this, you're totally flexed, or too flat, where you're going like that. But then you have a lot of people who they sleep on their tummy, prone sleepers, they lie on the tummy.
And then their neck turn.
Yeah. And so you have a lot of people, like my son, he sleeps on his tummy, and I look at him and said, boy, if I were to fall asleep on my tummy, would I wake up with a crick neck? Because at my age, the neuroforamen are kind of, squeezing down in a sense. And so I feel like even I could turn my neck here now, I feel a little pinch.
Yeah.
So if I were to ever to fall asleep, I'd get I would wake up with a crick neck. You understand? And so you get a crick in the neck. You get, you can also get, as I mentioned before, the headache. The headache that you get. Now, to answer another reason for the crick neck. So, for example, yesterday you were playing with your child, or you were lifting a bag, and you might have done a little strain in the muscle. You don't realize it, and then you go to bed, and it seizes up overnight, and then you wake up with a crick neck. So sometimes you may have injured it. You ever twist your ankle yet, and you go bed good,
and then you wake up
and you can't walk.
Like disaster, man.
Very much so.
And you wonder
what happened overnight.
Swelling happened overnight.
Bad.
That is what happened overnight.
Yeah, man. Hey, when you have a muscular injury and you think you get away, and then it seizes up and then the swelling sets in, problem.
Yeah, but how you prevent that? Because you have the injury.
Yes.
You have to go to sleep.
Yes, you can rice. Yeah.
All right. We can rice it. Yes.
For those of you who don't know what rice is.
Wow. That sounds wicked.
We should cut a tone.
Man.
So tell them what rice is.
Rest, ice, compress, elevate, right?
Yes, that's correct. So you rest
man.
the area, you ice the area, which is I in the rice. The C is?
Compress.
Compression, correct. And the E is?
Elevate.
Elevation. But you can't really elevate your neck per se. But that is the general musculoskeletal problem. And so in the neck, you have the intervertebral disc. You can get a slip disc in the neck.
You can get a slip disc in your neck?
Yeah, man. You can have a herniated disc in your neck. Especially for those people who are desk workers, who your head is always flexed. You can get a herniated disc in your neck. You can get spinal stenosis, where you get narrowing of the spaces in the neck where the nerves are going out and they get pinched. You can get that. You can get facet, which is arthritis, spondylosis.
Did you just say arthritis?
Yes, ma'am.
You know how much I hate that word?
I know.
In your neck?
Because you have joints in your neck. You remember those joints in the spine? It starts with a F or Z. Facet joint or zygapophyseal joint. The same.
Remember the facet ones.
Right. So the same joints you have in the lumbar spine. And so those joints in your neck, they can become arthritic. And so, degenerative changes in the neck is a fancy word for spondylosis. And what happens when you have that? You have decreased disc height. The discs are the cushioning segment. You have narrowing of the space through which the nerves exit. Right.
What does that look like outside physically?
Sometimes it can be a change in your posture.
Okay.
You notice as we grow older, when we're born, we're actually born like this. I'm showing you. Like this. With our chins tucked. if you look at children, they're like this. You know, the neck is straight, the chin
That's
is
why
back.
it looks so weird.
As you
Love
grow
children.
older, you do that. Gravity comes
And
and it
pulls
pulls your
you down.
neck forward. For those of you who are listening
Laws of
on
gravity.
the radio, what I did was I tucked my chin back straight, not looking up, not looking down. And that's how children look at a child around you. Their neck is nice and straight. But as you grow older, you're leaning forward. And that forward leaning can create spasms in the neck. It can compress the nerves in the neck. And then the discs can decrease in height. And so neck pain is something that it's so easy to treat. But guess what? It's a prevention. I love prevention. Prevention is better than
Cure.
Your grandmother always tell you that, not true?
All the time, my granny, yeah.
Prevention is better than cure. But I want to go into more details.
Yes. Gosh, I can't wait to get all of this detail.
Yes.
Prevention is better than cure. So I think we're coming up onto our break.
I think so.
Man, but when we come back from the
Yes.
break, we're going to talk about a lot of neck injuries like whiplash and
I know. Whiplash. You ever whip your head yet?
Oh.
Dancing? You mean the running
Well,
man?
maybe
You know
not
it's not running
dancing.
man. What's it called? The wop?
I don't even know what my hair, I don't know, but I know that I've gotten a whiplash before from a car accident.
Ah.
Yeah. So we're going to have all of that
Yes.
when we're back
Yes.
from the break.
From the break.
Welcome back to Rehab Now. If you're just joining us, we're talking about neck pain.
Pain.
We're talking about whiplash,
Oh boy.
prevention,
Yeah.
better than cure,
Definitely.
as our grannies
Used to say.
told us.
Absolutely.
Yes, man. So tell us a little bit, Doc.
All right. So neck injuries. I mean, you can get neck injuries from so many things. Things. Say things fast.
Things.
Very good.
Thank you.
Yeah. So you can get neck injuries from so many things. Before, there are some dances that you can get neck injuries from. You know,
Yes, man.
When you're whipping your neck from left to right
And all around.
and all around.
Really fast and wild.
Yes. Right. You can also get it from a car accident. Whiplash. And what is whiplash? People always ask, what is whiplash? So
Yeah.
whiplash, another name for whiplash is acceleration, deceleration injuries.
Okay.
Meaning the car is going fast and suddenly the car decelerates, it stops. And so the car has stopped, so your body continues to move.
Yeah.
And so your neck will
Pull back.
whip. Right, exactly.
So it goes forward and then pulls it back.
Right. And then what happens in a whiplash? It's
happens
so
to
many
me.
things that can happen in a whiplash. You can get these micro tears in the muscles. You can get these micro injuries to the ligaments in the spine. And the interesting thing is when you look at an MRI or on an X-ray, it's normal. You don't have any physiological or anatomical changes. What you may see, however, is what they say flattening of the lordosis. So the neck is naturally curved in a lordosis, like a backward C. That's the normal neck. But when the muscles go into spasm, it gets strained. So they call it loss of lordosis. So all the paraspinal muscles are now locked up and they're causing the spine to be strained. And so that's what you get with whiplash injury. The thing with whiplash injury, whiplash can be treated successfully.
Great. I
Sadly,
don't have whiplash anymore.
you don't have it anymore.
No.
Touch me, my girl.
But tell me, go on talk. Let me see if I'm right.
Yes. The thing with whiplash, though, is a lot of times, unfortunately, whiplash is associated with litigation cases, and sometimes the patients have, they're under so much pressure because of the fact that the accident might not be theirs. And so we find research has shown that patients that have injury to the spine that are related to litigations, or workman's comp, they do not do as well as someone who doesn't have a litigation case. So they're in the literature. I mean, the implication of that is sometimes when you're in an accident, I'm not saying that you don't really feel the pain, because you really do feel the pain, but they don't do as well, published in the literature, as someone who, if you were at home and you step out of the shower and you whip your neck, you come in, you tend to do better than if you were in a motor vehicle accident. But however, whiplash, I had a patient once who was in a serious plane crash. Plane crash. And when you look on the MRI, completely normal.
Really?
But had severe pain. And I knew the patient had severe pain. I knew the patient had pain, but you couldn't prove it because the MRI was completely normal. And so you have these micro tears and, quantification of pain. I had another patient who she was hit by a garbage truck. And you look at her MRI, completely normal, but she's, there was so much pain.
Yeah, but how do you identify what is wrong and treat what is wrong?
Well, so we just treat empirically. One, you have to treat, most of the time they'll have spasm. So you have to treat with muscle relaxer.
All right, cool.
You need some anti-inflammatories, so you treat them with some what we call NSAIDs. You also may have to treat them with high-end pain medication like, codeine or tramadol. Those are the high-end pain medication. And, of course, massage and, of course, physical therapy. So motion is lotion. What we find, no matter what, if you have a spine problem, therapy is always going to help you.
Okay.
But the most important thing is you have to play your part.
Yeah, you have to do the exercises.
Yeah, because if you come therapy twice a week or once a week or once every other week, you should do something every day. Maybe Sundays you get off. Oh, wow. Right? And that's the thing with neck pain. Neck pain is one of those things that almost everyone at some point in their life will have neck pain, and it can affect your health. It certainly can affect your health.
Okay, I have a question. This is going to sound weird.
Shoot.
You can break your neck?
You certainly can.
Okay.
And I'm glad you asked that question. What is breaking your neck?
Yeah.
So in the neck, we have joints called facet joints.
Yeah.
And those are the joints through which the spine articulates. Not articulate as in speaking, but move. Right, range. And sometimes those two bones, you can actually jump facet. You can jump facet, that's when you break your neck. So the vertebral bodies are on top of each other, and they jump, meaning so you fall, you dive, unfortunately. If you dive into a pool and the pool is too short, you hit your neck, you can break your neck. You can have a jump facet.
Okay.
All right? You can have a bad flexion extension injury, which is so bad, where you can actually have a jump. That's what when you break your neck.
And that's excruciatingly painful, isn't it?
Well, when that happens, look at this. So when you have two vertebral bodies on top of each other with a hole in the middle, when you move it one side, what happens to the hole?
It's exposed.
Right, but the hole gets smaller. And what's in the hole? The spinal cord. So you can get spinal cord injury, right? And so a lot of times when you have bilateral jump facet, in the literature it says usually how you get spinal cord injury. You usually get spinal cord injury. But I've seen patients in Jamaica that have had bilateral jump facets and go to UE and KPH and have surgery and recover.
You have to do surgery if you have.
Yes, man, because if you jump a facet, it's an emergency. Depending on where the level, especially in the cervical spine, you must stabilize it with surgery. So you see a neurosurgeon or orthopedic surgeon who is skilled at stabilizing the spine. Now, if the injury to the spine is between the first, second, and third, and fourth and fifth, so 3, 4, 5, keep the diaphragm alive. Those nerves actually go to the diaphragm. 3, 4, 5, keep the diaphragm alive. And when you injure those nerves, you have problems breathing. And so patients with high spinal cord injury, they need to be on a ventilator.
Are you serious?
Because they can't ventilate as well. 3, 4, 5, keep the diaphragm alive, along with another cranial nerve, and then your intercostal muscles.
Yeah, man.
You need the nerves. So the cervical spine is something, it is amazing. But guess what? You can do rehab to strengthen your neck. The first thing you want to do is to make sure you have good range of motion. So we always tell patients, providing you don't have any contraindication, speak to someone first. You turn your neck. You want to get full range, right and left, up and down, tilt to the right, tilt to the left. You want to bring your chin down to your left shoulder without bringing your shoulder up. And bring your chin to your right shoulder without bringing... You feel that stretch, Alicia? Make sure you don't do this unless you clear by your doctor. We have this thing that we call biscapular retraction. Big word.
It is.
Bi just mean two. Okay. Scapular retraction.
Okay.
So the two of your scapula them, how you pluralize scapula? Scapula them.
Scapula them.
Scapulae. By scapular retraction. So you pull your scapula back and you bring your chin back. So that's called chin tuck. So you're not tucking down with the chin and you're not tucking up, you're tucking directly back. And that will help to kind of bring back the cervical lordosis, which is that nice curve in the cervical spine. All right, so in addition to that, you need to strengthen the muscles in your neck. And how do you do that? Take one guess. How do you can't lift weights with your head.
Stretching?
You have a good point there, So every action that your neck can do, you do it against resistance. What do I mean by that? Tilt to the right. You try to tilt to the right against your hand, but you don't move the head. Tilt to the left against your hand. So you're tilting your head to the left and you put your hand on the side of your head, but you don't allow your head to turn to the left. And same thing, you're bringing your chin down, you put your hand on your forehead, both hands on your forehead, you bend forward, but you push back, so you're not moving. And then you put your hand behind your head and you're leaning back the head, but you're not moving. At the top of the head, not at your neck, at the top of your head. And similarly, you're turning. So you turn, put your hand on your chin, turn to the right, but you're not moving your head, you're still looking forward. And then you, like so, turn to the part. We're on a different part. She was still on the back of her head, guys. And so you're turning to the right, but you're not moving, resisting. Put your hand on your jawbone, and you turn to the left, put your hand on your jawbone. You ever see those guys in the NFL?
I see them all the time.
You see the necks? The NFL guys' necks, they're huge, the muscles in the neck. You know
What
why?
Oh my God.
Because they use their head to tackle. Especially the running back or
so
the lineback. The lineback.
My gosh.
So you ever see those guys when you see NFL, you see them talking and the neck is like way out
They
here?
look like
Because they need the muscles to protect the spine. Yeah.
they look like them like some cobra necks. You know what I'm saying? Yeah. I'm looking at them like that's huge, man.
That's huge.
So it's because they're working those muscles.
They have to work those muscles.
Man,
yeah, man, because they need the muscles
cool.
because they're using their neck. And sometimes you can get something called burners or stingers. It's in sports medicine where they tackle, and so you get a retraction. So the shoulders go down, depressed, and the head goes in the opposite direction to the shoulder. You have a traction on the neck, and you can actually injure the nerve. You can have so much traction that you tear out the nerve root and you get complete paralysis.
Wow.
Of their hand. But then burners or stingers are transient. Those are like a transient electric shock that you feel, and you have to take them out the game, and then it allows allow time for it to recover.
You said paralysis of the hand.
Yes.
That can actually happen with the neck.
Yes, it can actually happen with the neck. So I'm glad you asked that question. So you're really good.
Thank you very much. I appreciate it.
Because the cervical spine is where you have the nerves that go to the arm. Mm-hmm. So you have C4, C5, C6, C7, C8, all the cervical spine nerves. So C5 is elbow flexion. You remember when you used to when you were in little school, and they say 1, 2, buckle my shoe.
I was never little, but okay.
1, 2, buckle my shoe.
Yeah.
3, 4, shut the door. 5, 6, pick up 6. So C5, C6.
That's what
pick
we were
up
talking
6.
about?
7, 8, C7, C8. Lay them straight.
We were doing like a medical thing.
Anatomy. Yeah.
That's so cool.
And guess what? L1, L2, 1, 2, buckle my shoe is bending your hip and going down. 3, 4, kick the door. L4, L5. Quadriceps muscle, you kick the door straight. I know, 1, 2, buckle my shoes. Medicine. So 5, 6, pick up sticks, bending your elbow. 7, 8, lay them straight.
9, 10, a big fat hen. Sorry, hold that one coming. Because
well,
I think that one was just for laughs.
That one was for laughs.
9, 10, a big fat hen.
9, 10, a big fat hen. And so to answer your question, with the paralysis, you can. And so if you injure any one of the nerves going to the arm, you can have weakness in the arm. So there's this thing called arc. So for example, older folks, when they have injury to the lower cervical spine muscles, the cervical spine nerve, C7 and C8, you get what we call wasting of the muscles in the hand. And so you get weakness with, we call this thing now spine coordination. But then therapy, depending on how bad the injury is, you may need surgery. I used to do epidural steroids injection in the neck. I don't practice that anymore. I only do it in the lower back now, but you can have steroid injection in the neck. But what I do a lot of, we're going to talk about it, is spine injection around the muscles. So we do a lot of trigger injections. Okay. We have patients come in and they can't turn their necks, and we inject them before they leave.
Baps.
The pain goes away. So we use the lidocaine and steroids. So the patients actually do very well. Important thing is prevention better than cure.
It is.
How do you prevent that? Just make sure you have good posture. A lot of times, like for me, I tell you I used to race cars?
You used to do what?
I used to be a navigator.
I feel like
used
you
to-
did a lot of things in your lifetime.
I used to be a member of Montego Bay Motoring Club. Big up, mommy! And then I used to be a member of Jamaica Motoring Club. Big up, Kingston. So we used to race cars. And so I used to be a navigator. So as a navigator, I used to navigate with David Watkin, Lily's Chin, Peter Moody Jr., what heap of people. Jody Somerville, David Somerville's sister. The car turned over, you know. And we
Yes,
turn it back
sir.
over, we drop back in the car and finish it. But we used to have a 5-point seat belt. So one between your legs, 2 over your shoulder, and 1 to your side. So my head used to be down like this a lot when we racing the cars or going through the KNP, so we're doing our special stages. So I have neck pain. So now, by the time before the highway, when I reach Flatbridge, my neck will burn me because of pain. So I kind of have to have a driver when I'm going out of town to see patients in Mobile because we get bad neck pain. But since I've been having therapy with the guys at
Rehab Institute of the Caribbean.
my neck pain is so much better. But posture, the position you hold in your neck is important in one, preventing neck pain and throwing off your posture.
And that posture is, or that position is?
Well, a neutral spine, so your shoulders back, your chin tucked backwards, and you're looking straight ahead. Right.
And that is going to help you.
Well, that will just prevent you from getting worse, but you still have to make sure you get your range of motion and your strength going.
Range of motion, strength going, and proper posture.
Absolutely.
That's going to help to prevent your neck pain.
Yes, ma'am.
Neck paralysis. Well, actually, just neck pain.
Just
Because,
neck pain.
some other things can happen that cause the
Absolutely.
paralysis. But yeah, I think, my time up already?
Time's up already, my God. Time flies when you're having fun.
Man, yeah. Well, I think the most important thing I learned today was the 1, 2, buckle my shoe, the 3, 4, out the
Shut
door.
the door.
Man,
Yes.
that's
Anatomy.
good stuff. Thank you, everybody, for listening.
Yes.
Thank you, Power 106, our studio engineer, show producers, Renee, Stacy, Jeff. Thank you so very much. We will see you guys next week. Thank you to our sponsors, the Rehabilitation Institute of the Caribbean,
Yes.
Winchester MRI, Immune Active Tank, and Almighty Studios. Remember, Rehabilitation Institute of the Caribbean is located at Suite 2A to see Legany Post Mall. Give us a call, 978-4009-10, and visit our website, rehabcaribbean.com. We'll see you guys next week. Bye-bye. Blessings.
Blessings.